My name is Tammy Pozerycki, and I'm the Community Liaison at Westboro Behavioral Healthcare Hospital. And I am here today to do our next installment of Mental Health Wellness, A Journey of Healing. And my guest is Mary Beth, and I'm going to have Mary Beth tell you a little bit more about her and what she does. And why I brought her along here is to talk about recovery today. We are both at different ends of recovery, or different services, or different parts of the continuum of care for recovery. And so Mary Beth, tell us about you.
Sure.
And you know, what brought you to where you are now?
Okay. Hi, Tammy. Thanks for having me today. So I am the Executive Director at New England Recovery Center in Westboro. So we are a subsidiary of Spectrum Health Systems, and NERC is the acronym. It's an 84-bed detox and residential program. So we have a 36-bed detox, and then the continuum of care to residential, where our clients, you know, depending on their need, can stay up to 30 days in treatment with us. So many years ago, I fell in love with this work. I was working in the Worcester County House of Correction as a social worker, and just learned very quickly that anybody, inmate, client, you know, that was dealing with substance use disorder had mental health.
That's a tough population.
It
Wow.
was. Yeah, it is. But they're in such need and misunderstood, obviously, in so many ways. We've come so far, but there's still such a stigma on, you know, substance use disorder. I'm not a numbers person, but in all my work, you know, there's not been one person I've worked with that doesn't suffer from mental health.
Oh, yeah.
Disorder. You know, it's a coping mechanism.
I was just going to ask you that. Do you think that substance use disorder is sort of the secondary to mental illness?
Absolutely.
Yeah.
I think I say that every single day. You know,
and we
talking
say
with
mental
clients.
illness, but what
Right.
we could, and we hear that mental illness,
Right.
and there's such a stigma with it.
There is still.
But you know, I think the depression, the anxiety, the things that kind of push us to look towards coping mechanisms, and it's easy. Alcohol's easy to get. Now marijuana's easy to get.
It is.
So what did you do after corrections?
So I decided, working in corrections, that, you know, I originally started out wanting to do grief work. I wanted to, you know, work in a hospice, but learning more and more about addiction and substance use disorder, it's more often than not grief related. So I found myself doing a lot of healing work, a lot of trauma work, and I wanted to do more with it. So I went back to school and, you know, just kind of focused on this field, you know, integrating grief and trauma work, obviously, with my focus. So eventually, Spectrum Health Systems, I worked with Spectrum Health Systems, and started out with the PAVE program, the domestic violence program, and then the driver alcohol education program, and just stayed with Spectrum through the years, and now I am at New England Recovery Center, managing the program, and it's just, we do such amazing work there, and we see so many success stories. I don't think people realize that so many good outcomes happen. We only see the relapses and the people, you know, you hear more about that, but we just have such hope with the work that takes place, you know, not just at New England Recovery Center, but, you know, continuum of care, you know, just this whole kind of cycle effect of, you know, what we need. It's not just, you know, it's a combination of things, and it's very individually based. You know, some clients leave, and, you know, AA is so much part of their life, but then they realize that they need more to it. You know, they need, you know, it's a great focus, and then, you know, maybe some therapy or some outpatient programming, usually as part of the aftercare plan.
What is your age range that you serve?
Sure. So 18 plus.
Okay.
So we just had we have folks that are in their later life that, you know, realize, and we've seen a lot after that since COVID, folks who have been, you know, say sober for 20 something years have relapsed, and, you know, just with AA meetings being online, therapy being online, just that lack of connection, especially with that older generation, we've seen a lot of that. So
that's interesting, right?
so
The stressors from the pandemic.
from the pandemic, just people losing connection, which is
I've heard that connection is the way for success in recovery.
absolutely.
What do we mean by that, connection
So
in recovery, and how does that work for people in recovery? What does making connections even mean?
So active addiction, most often folks are doing this on a isolated basis. There's a lot of shame, there's a lot of guilt, there's a lot of just embarrassment with it. So folks just kind of do this solo on their own. So the opposite of addiction is connection.
That's the quote I heard.
Yeah.
Opposite of addiction is connection.
Yes.
Okay.
It's always the case. Now, even the most introverted person, needs connection.
Right.
So in some way, and that could be one person through therapy or a sober group or something that, you don't have to be this, a lot of people think connection means this huge community. It can just mean one or two connections that you have that can propel you into the next stages of your recovery.
So can you please walk us through someone who has entered, what this person who has decided, I'm assuming they've decided that it is time to get healthy, it is time to stop using, so they come to you. And so if you could walk us through, because you've said that you've seen the success stories, and I would love the audience to know what that looks like. From day one, what does that look like?
Sure. So anybody who comes through our detox program on day one is in crisis. So there was something that took place prior to them coming in that said, this is it, I have to get help. Now, a lot of times that can be a family member saying, you have to do this. It can be a court situation, but oftentimes we see folks just come in voluntarily and I've had it, I need to have a better life. So they walk through our doors, they're greeted by our admissions team, they go through the whole intake process, and then immediately they're met, after 24 hours, they're met with our clinical team. And, we talk about what steps need to take place, what brought them in with us, and what their individualized treatment may look like. So a lot of times there's a long history of this, and sometimes there aren't. We have a lot of young folks coming in too. Seen such a nice success rate with them as well, because there's so much more now in the community for our young folks coming in than there had been even 20 years ago when I started out with this. So that's really hopeful. So it depends on the client, but they, depending on what the need is, they oftentimes go through our 5 to 7 day detox, depending on the substance. And they can transition to our residential program, where there's more individualized therapy, there's group therapy, they'll meet with a clinician individually so that they can decipher what their need is. It's a process, and a lot of our folks have a hard time, opening up. It can be, there's so much shame to it, but in our program, I believe that that's the first step, is normalizing it. It's, everybody has some level of mental health.
Right. Right.
So, so just kind of normalizing that, and, this is their time to get well. So then, they go through, develop a transition plan throughout our program. During the program, they're introduced to AA, NA. We have commitment meetings pretty much every night where outside commitments come in and talk about their stories of hope, which is really motivating.
I like that.
Yeah, that's really a great part to what happens is, just seeing some real folks going through it, maybe have come through the program and are doing really well. We have a family engagement piece too, which is really great. A lot of our folks, their families don't understand this process.
Right.
So part of our job is to educate. So, if they're going home to the family, educating the family on what this looks like and what needs to happen, and, coming from a place of empathy, despite everything that's happened up until that point, because it just really opens up the doors for communication and for further help. So if those pieces are in place, you know, the success rate is really good. You know, having said that, we do have some folks, you know, obviously relapse is part of addiction. It's part of the process for so many. I think there's a stigma on that, but normalizing that as well. And that just means that we need to add another piece to the equation that was missing. So it's a learning process.
I think with the public view, it has changed. Like, I remember being young and the term alcoholic meant a certain kind of person, you know? And now it's touching people that, you know, are super intelligent.
Absolutely.
They're doctors, they're lawyers, they're engineers, they're... So it's actually good in a way that where people are talking about their addictions to remove the stigma.
Absolutely.
You know, I know we work with the first responder population and finding lots of addiction in that culture.
Absolutely.
So it really is everywhere.
Think about the trauma that they witness. And so much of this is grief and trauma-based.
Absolutely.
Sense needing to heal. So if you think about that population and recently so much what they experience, it makes sense why maladaptive coping skills take place.
Right, right. How long would you say someone, I mean, it could be as easy as you saying, well, it's very individual, but on average, do you think from detox through residential to back in the community, do you see time-wise, length, I guess months, is it?
In our program, it depends. So in our program, it's 30 days. We could go more than that, depending on need and medical necessity. But a lot of our folks leave our program at residential and transition to another step-down program, which could be a sober living program with a partial hospitalization program. With that, some folks just need a step-down, less restriction from what they experience with us at New England Recovery Center, but just kind of a slower reintegration into the world.
Right.
Where those walls are still there, there's still that protective mechanism to keep them separate from the substance, while integrating all of the tools that we're going to put in place to sustain recovery.
Is the whole program and residential co-ed?
Yes.
Okay.
Yes.
All right.
So people go, oh, okay, you know, but it works great because a lot of the times interpersonal skills in unhealthy relationships are part of this process. So we get that, we understand that, and sometimes we see that play out in treatment, and that's our opportunity to say, okay, what is a healthy relationship? What isn't a healthy relationship to you? Identify that, and how do we, you know, move forward to ensure that we're in safe, healthy spaces.
Where is New England Recovery located? I've been there, but maybe our viewers have never been there.
We are located at 153 Oak Street in Westboro. So we're on the Spectrum campus, right next to the Westboro District Court.
Which is, I believe you guys are like less than 2 miles away from us.
I know.
So I wanted to also educate the viewers about, you had mentioned sort of the continuum, and some folks need a partial hospitalization and what that looks like. We have a program called Taking Hold.
Okay.
And Taking Hold is a partial hospitalization program for those in recovery needing that support after a program like yours.
Great.
And I think if people understand the continuum, they know that this is a journey. This isn't just, you know, stop drinking, I'm done, or stop using, I'm done. And so the partial hospitalization program is a lovely way to get back into the community.
Absolutely.
Have you ever had anyone in residential go to a partial? Or do they do it after?
Okay. So it doesn't go concurrently. It's a step down.
Okay.
That is honestly our primary aftercare plan for many of our folks, you know, if they can do it, if they
Right.
can, if they can take the time from work, and we get that, you know, that a lot of folks, they have to get back to work. You know, if you're having financial troubles and all of that, it certainly can add to the stress, but we have to incorporate it somehow. But many of our folks leaving treatment do attend partial hospitalization. It's a great treatment plan to reintegrate.
Right, and we have the partial program of Taking Hold, which is 5 days a week, and
Excellent.
our lead clinician, Joshua Lampkin, he runs that, and our folks can participate virtually if that, I mean, I personally think being in person is the way to go.
It is.
Because we have all of our enhanced modalities that go along with the program. Like I mentioned to you, Gilbert, our
Yes.
needs assistant dog, he makes visits.
Yes.
We do trauma-sensitive yoga, music therapy, those types of things. And those are integrated into the Taking Hold program. Josh has told me he follows the Seeking Safety curriculum. I am not a clinician, so I'm not really aware of what that entails, but dialectic behavioral therapy, cognitive behavioral therapy. And after the 5 days of partial, some of them will choose to do a step down. You had mentioned step down to IOP,
Right.
intensive outpatient, which is 3 days a week. We do have an evening IOP
That's
that we
great.
just started.
So
Well,
much-
it's late afternoon, evening. It's 3 to 6:30.
Yep.
But then what's good about that whole journey is, say they go through your program, your residential, they come to Westboro, they do the PHP, then we have discharge planners who get them set up with what they need in the community, whether that's, you know, a therapist, a psychiatrist.
The psychiatrist is so important.
Yeah.
That is such an important piece, because our clients are self-medicating. They're self-medicating their mental health symptoms. So getting a good psychiatric evaluation is imperative. And they receive that when they come into New England Recovery Center residential program. We wait till folks are obviously detoxed before they have an evaluation with our psychiatrist. But starting that process and then continuing it outpatient.
So the psychiatrist who sees them in the residential program, is he or she an outpatient therapist? In other words, or are they working at your facility?
Both.
Oh, okay.
So our physicians they start the process at New England Recovery Center, and it can just be for the outpatient need. I'm sorry, the inpatient need, and you know, and then they can see them in the outpatient level as well, because they're Spectrum. They're working for Spectrum. So we have the 15 outpatient sites that we can continue services with our physicians that way. But there are some who live in other communities where they need more connection medically, and we can do that as well, which would be great, you know, with your services.
Yeah, I mean, it's a nice flow.
It is.
And where we're so close to you, I'm like, oh my gosh,
I know,
we should
I know.
be
It's
partnering,
perfect.
right?
Absolutely.
Because we don't do what you do, and
Right.
you don't do what we do.
We
so
don't.
it makes perfect sense that
does.
we would work together.
It really does. It really does.
One of the things that I'm sure the audience is, who pays for this, right? So who pays for this, their loved one's journey through this whole thing?
So we're contracted with every insurance. We're commercially insured, as well as we accept Tufts Mass Health. So and we do have a private pay option as well if for some reason your insurance doesn't cover it, but we're a network with all insurance companies.
Does your facility ever, like say you have someone give you an insurance you're not contracted with, are you able to negotiate like a single-use contract? Sometimes
Single
insurances,
case agreement.
Case agreement.
Yes.
Thank
yes.
you.
Yeah. No worries.
Single case
yes,
agreement.
we have been able to do that. Yep.
Okay, that's good to know.
Yes. Yes.
And we at Westboro, we do the Mass Health and Medicare and
Perfect.
a lot of the insurances as well. How does Spectrum work with New England Recovery are? I guess I'm a little confused as the
Sure.
Spectrum
question.
umbrella.
Yes.
And then you have New England Recovery. So what is
Yes.
Spectrum?
So Spectrum has been around for 40-something years. So Spectrum is the publicly funded version. So we are the commercially insured private version. We're a subsidiary of Spectrum. So Spectrum has a detox on campus we work collaboratively with, and a residential program, a crisis stabilization program as well. And also they have a step-down program for longer term. So our residential program, clients can stay there up until a year. They can go back to work. So we work hand in hand with them as well. We're collaborative. We're all a team on campus. So
What would depend? Like, what would make someone go to the Spectrum detox versus New England Recovery?
if they had, say, a Mass Health insurance policy that we didn't accept. So we only accept Tufts Mass Health, or if they didn't have insurance. So DPH would fund those individuals. So it's a beautiful thing because everybody gets services and we work collaboratively with each other. We're one. Spectrum and New England Recovery Center.
I did take a tour
Yeah.
of New England Recovery, and it's beautiful.
Thank you.
It is a beautiful spot.
Thank you.
Beautiful campus. It is a campus.
Yeah,
you know,
yeah, it is.
And there were some old buildings. I don't know if that's something you were acquiring or.
No, we're doing a lot of work on campus, though. To speak to the collaborative approach that we have with Spectrum and New England Recovery Center, we're actually building. If you take up, you should come up soon. You should see all the things that we're doing up there because we're building a central intake. So right now, New England Recovery Center and Spectrum have separate admissions processes. Within the next 8 months, we're going to have just one center for all clients to enter in treatment.
Nice.
So it's, just very collaborative, working together, looking at somebody and saying, what is your need and what program would be great for you? So we have a lot going on. There's a lot of construction. It's going to be great once it's there, but it's kind of, in the process right now. But
I think the most important question would be, if I was interested
yes.
in your program,
Yes.
how do I begin the process with you? How do I know I should call, tell the audience what's the best way for me to see New England Recovery, make the call,
Sure.
who do I contact?
Sure, you could call our admissions department, 1-877-MY-REHAB.
I like that.
Yeah,
1-877-MY-REHAB.
Easy.
That is easy.
Yep, or you could send an email to info@newenglandrecoverycenter.org, and there's people on 24/7. So we have an entire team that are answering our phones, and you could reach out and somebody would direct you to the right process facility. And again, it's all in how it begins. That first phone call is the most important thing. And our staff is I can't speak enough to that team and how they, engage folks on the phone because they're calling in crisis. So, we have to be understanding, we have to be compassionate, we have to, just be very patient and really understand the process. We talk to families all the time. I've had people come up and have tours and just say, is this the right place for me? And if it's not, we'll find you somewhere else. When there's a window of opportunity, you have to jump on it.
Absolutely.
So that's why we're 24 hours. You can't just say, let me call you back tomorrow. It doesn't work. It's gone.
Right.
That bravery is just sometimes out the window, and understandably so. So our team is really versed in those initial first steps. Because once you're there, and you need to move and get
And
it.
you had mentioned that some people have a court order, right?
Sure.
That they have to go through
Oftentimes.
detox. How does that work in terms of security? And what I mean by that is addiction is powerful. So how do they not leave or have someone brings something in, or
question.
they're very creative. I know,
Great question.
Yeah.
We are very well versed in that. You're right. Addiction is powerful, and it's not. Clients have said to me so many times, "I'm so ashamed of the things that I've done while using," and the question is that who you are today, sitting here? And the answer is absolutely not. Addiction is powerful. And we understand that those behaviors that take place outside of treatment, they're going to show up in treatment. So we have many, many systems in place to assure that people come into our program safely. We have a very trained staff on what that looks like. And, we work with people. We've realized that people are coming in on probation. I mean, they're not ready. They're scared. They're petrified of being sick. And facing all the things, that they've done to up until this point to support their active addiction, which is really, really dark. And
you serve 18 plus. Is there any talk or plans of serving adolescents?
It's funny you ask. We actually have it's called a waiver in place right now for 16 to 17-year-olds.
Oh,
we work
I'm
with.
glad you're mentioning this.
Yes, so we work with MIR.
Oh, right.
In Worcester.
Mm-hmm.
So if it's been a work in progress. It's been about a year, but it's been going really, really well. So if there's overflow there, they don't have a bed, which it's sad. They're full.
I know.
Quite a bit. So we accept on an individualized basis 16 to 17-year-olds for detox, male and female.
So this is very important for me to know because we have an adolescent program.
Oh, wow.
But we don't specialize in the substance use disorder. We talk about it. We have kiddos that are in there who are,
I bet.
That is an issue, right?
Of course.
And if they need that level of care, they're not appropriate for our program.
Right.
So we're constantly looking, and I just had my case manager ask me,
oh my goodness.
because MIR had a wait list. So I did not know that. So does the waiver apply to most insurances? Is that how that works?
It does.
Can you do you only have a couple of beds slated for that?
We do, but if somebody was in need, we would accommodate.
So
Absolutely.
now I can go back to my team and at least share that with them.
We have a collaborative relationship with MIR. So anytime we receive a referral, we go through them first, because it's more appropriate for an adolescent to go to an adolescent program, obviously.
Right.
But we've seen such benefits to some of our youth coming through NERC because some of our older clients will, just be motivation for them. Yeah. And our staff, it's really, it just feels like
that's a
very
tough,
nurturing environment for them to come through,
I love it. I love that you're able to do that.
It's funny you ask that because this is really new. But if you were to call New England Recovery Center and say you had a 16 or 17-year-old adolescent needing detox or residential treatment, we would first call them to see if they had bed availability, and then we would work through that if not.
Terrific news for us. We don't, the other issue, we don't specialize in eating disorders. So that's another sort of thing that we have to refer out. And I think that just knowing everybody has their niche in what they do. And just so the audience knows, MIR, M-Y-R, is addiction specialty for adolescents, and they're in demand. There's just not a lot of resources for adolescents right now, and post-pandemic, the addictions are rampant.
They are.
So
it's scary what these kids are experiencing right now. It's unbelievable.
Well, I think that this has been a fabulous interview.
Thank you.
And I think I'll wrap up with anything you'd like the audience to know that we haven't discussed. Is there anything you can think of?
No, I can't. I don't think so. Just know that if you're out there and you need some help, that to just call us and we'll help you. Trying to figure out resources when you're dealing with this is really, really hard. you know, it's just, it can be very lonely. You know, you pick up the phone, you call us, and we'll help you navigate it, because it can be really hard to make that first step. But we're happy to help. And
I think the great thing to know is that you don't have to be not drinking to go to your
that's a great
facility.
point.
I mean,
Right.
you can be actively drinking or using or anything,
Absolutely.
because you're going to be the folks that help them to wean off of that.
Correct.
Right?
That's the first step. And then many of our folks come in, oh, I'm feeling like I'm on a bad path. I stopped going to my therapist. I stopped going to my AA meeting, my NA meeting. I'm feeling like I was feeling. You don't have to be in full relapse to come back. We have a residential program. We can take you and do a direct residential admission.
Wow.
Yeah.
So they don't have to go through all that.
We tell people when they leave, if you need us and you need something in the community that's missing, you know, we didn't set it up, or maybe we didn't realize you needed this, call us. You don't have to be coming back through the doors through detox. Pick up the phone. They make a really good connection with our clinicians at residential. We will help you find resources out there. You don't have to get to that space.
This has been fabulous.
Thank you.
Thank you
I enjoyed
so
it.
much. So
Thank you, Tammy.
educational.
I appreciate it.
And we will put all of Mary Beth's information and New England Recovery Center information up for you for your information. And if you have any questions about Westboro Behavioral Healthcare Hospital and what we do, you'll also have my information. So thank you for tuning in today, and hopefully we'll see you again.